welcome to Inskriba Conversation. Intro to another sector, the health sector, and I have a doctor here. We'll just jump right straight into it. Please introduce yourself. But first and foremost, welcome to Inskriba Conversations.
Thank you.
So please, yeah, you're welcome. Please introduce yourself.
All right. My name is Nana Abadri, and I'm referred to as Dr. Nana or Dr. Abadri, whichever is comfortable for
Mm.
one such me. I'm a medical doctor. Currently a medical doctor. I graduated in 2019, so I've been practicing, and I've been practicing since 2020. Helping me specialize in the medical doctor, and I currently practice in Lagos.
Yeah, nice. 2020. So you started practicing
Yeah.
during COVID.
Yes.
Did it? Was it? Did it have an effect? Obviously, it did. But
Definitely.
how did? Yeah.
Definitely. Literally, because okay, so the way it works in Nigeria, after your medical school, you do housemanship. So I couldn't go straight to housemanship because I'm foreign trained. So I came back
Oh, okay.
2019 and I had to write my licensing exams. I wrote my licensing exams in 2019. I was inducted in 2020, and then I started practicing. I resumed for my housemanship in March. And I kid you not, literally the week I resumed was the week that we went into lockdown.
Oh, wow.
Like shortly after the day I resumed, it was crazy. It was actually crazy. So my housemanship was in UITH, that's University of Ilorin Teaching Hospital. And
okay.
yeah, Ilorin took the lockdown really seriously. And
Really
honestly,
seriously? Okay.
I must commend them. They were I think they're one of the first states to go into lockdown. And they're very, very strict about movement and all that. So I think it really helped. I think it really helped them. Well, as for the way COVID affected my housemanship, okay. So by the end of my housemanship ended in 2021. Things had more or less come back to normal.
Yeah.
Well, when I started, there were a lot of things that we used to do that we couldn't do anymore. So like daily rounds, for example. Before in a unit, I started in obstetrics and gynecology. Just brief little sprinkle. So for housemanship, you rotate through 4 major departments: that's obstetrics and gynecology, surgery, internal medicine. Yes. So I started with obstetrics and gynecology. So usually all the doctors used to come every day, see all their patients, and then surgery days were assigned to certain teams and all that. But because of this, because of COVID, we're trying to minimize contact with patients and all that.
Yeah.
So elective surgeries were practically cancelled. So there were so many surgeries that we pushed back. Of course, emergency surgeries would be done because they're emergencies.
True.
Yeah, but so many surgeries were pushed back. A lot of people were not on admission. The point was basically just like emergency cases that we were attending to.
Yeah.
Yeah, so you couldn't really do that PD visits. It was really very rigidly regimented. So
Yeah.
so we didn't go to work as frequently as we should have. Yeah, they made time so you would basically maybe you go to work today and then the next time you'd be at work 3 days later. The whole point of that was to minimize, contact with patients just in case. The irony was that because of this, basically everybody saw everybody's patient. So let's say Dr. A has Dr. B has 3 patients. Because of the way the rota was, we now made it that okay, only Dr. A will be on duty on this day, and Dr. A will see everybody's patient.
We see everybody. Okay.
Yeah. So, but then the next time Dr. A is around, like in 3 days, that was what we were doing. There was actually a patient who tested positive for COVID, and because of the way we had made the rota, all of us were exposed to her at the end of the day. because
Yeah.
all of us, yeah. So it was crazy,
Mm-hmm.
actually. It was crazy. But yeah, it
Yeah.
definitely affected. It affected the
Yeah.
result. Clinics, there were no clinics, which sucked.
There were no
So
clinics. Ah.
no clinics at all. So any outpatient thing we did was strictly on an emergency basis. There were no clinics
Mm-hmm.
running. So that was actually a crazy era. Everyone was wearing face masks, of course.
Yeah.
So,
Yeah.
so I didn't know how a lot of my coworkers actually looked like. It was shocking to later
True.
see
True.
people afterwards. Yeah.
Their faces. Yeah.
Mhm.
Huh. That's interesting. Did that so I guess mm, and this is one of the reasons why we're looking at that's why the health sector is important, especially as a system in daily lives of Nigerians, Africans, anywhere, in fact. And that's why this is part of the Inskriba conversations. And just disclaimer, we're not giving out healthcare advice. We're not giving you prescription. We're not advertising any drug or medicine, any prescription. We're just having a conversation about health. Um, but um, you said, um, what's the difference between a clinic and a hospital?
Oh, okay. Um, clinic, clinic is what most people come for when they're coming to the hospital. So a clinic
Okay.
is just, it's outpatient, right? So you
Yeah.
basically just walk into the hospital, you have your campaign, and
Mm-hmm.
you have your consultation with the doctor, and your
Yeah.
doctor, yeah, then your medications are prescribed, your test orders. That concept is clinic,
Mm-hmm.
right? So it's
Okay.
just outpatient business.
Mm-hmm.
The hospital is
Yeah.
the rest of the body in which, when a patient needs to be admitted, they're no longer on a clinical,
Oh,
they're no longer in the clinic,
yeah.
they're now going to be admitted
Mm-hmm.
into the
Hot
hospital,
to the hospital. Mm-hmm. So every hospital has a clinic.
more or less, yeah. We
Okay.
just say outpatient,
Um.
and we say
Okay.
outpatient,
Okay.
that's outpatient.
Mm-hmm. I mean, and that's again, that's some of the questions we're trying to understand, especially for Nigerians, how they interact with everything that has to do with their health. But before we move on, you said you didn't study you, in Nigeria. Do you
Yeah,
want to
I didn't study in
give
Nigeria.
us insight into
I studied in
how that
Ukraine.
journey was? Okay.
Yes, I studied in Ukraine. That was from 2013 to 2019.
Mm.
That was a whole other
How was
experience.
that? Ah, I can
Honestly,
imagine.
I think I've been, what I'll use blessed. I'm glad I have mostly good experience. Like I have mostly good memories of that time. So
Mm-hmm.
there were a lot of course, there were a lot of cultural differences and all sorts that occurred
Yeah.
when I first went there. But it was a nice experience overall. The school I went to, there were there's some little things that, looking back, maybe I'd have chosen another school just so I
Mm-hmm.
could get a more hands-on experience. But at the end of the day, like everybody keeps learning, and
True.
yeah, so I won't say that was a major step back for me. I don't
Mm.
think that was a major step. So, but my time in Ukraine, I look back at it fondly. Because at the end of the day, that's where I went to school, and I was left with
Yeah.
confidence. It was okay.
Mm.
It was okay.
Yeah. Was there a major difference between you? I mean, maybe not. I mean, obviously, there's going to be difference, but when you came back, was there any? Um, because what we tend to think about, especially for people who study abroad, is that you get the quality of education you get, especially for programs like medicine. Um, it's usually looked upon as, "Oh, okay, yeah, rest of the world or outside Africa is usually more advanced. Um, did you was that the case for you, or when
Yeah,
you came back it was just
okay. Well, so for me, I mean, I can only speak from personal experience.
mm-hmm.
So you're like you said, there's always this impression that once it's outside Nigeria, it's better.
Yeah.
I don't know why
Mm-hmm.
we do that to ourselves. It's
Mm-hmm.
outside Nigeria. So for, personally, the reason why I went to Ukraine was actually because um, so my initial jam results were I had to write
Inconclusive.
incomplete. Yes, I think one of my results was incomplete.
Oh.
So the my
Ah.
practical subjects like English and then physics, chemistry, biology. I think one of them
Mm-hmm.
wasn't was not there. Only physics. The result wasn't there. So I mean, it's an
Yeah.
incomplete result. So
Yeah.
um, so I had to wait till the next year. So I wrote to them.
Mm-hmm.
My friends were like, you know what? Let's have two pathways. Let's do two
Yeah.
pathways. So I wrote jam again, but then we also
Mm-hmm.
started the train pathway because we had heard good things about it at the time. It was somewhat
Yeah.
affordable,
Mm-hmm.
and then there was added benefits of it being outside the country. So it's like, okay, let's try this outside thing and see where it goes. And
Mm-hmm.
like you said, there's that mentality that okay, it's outside Nigeria should be better than me.
Mm-hmm.
So getting to Ukraine was I'm not just going to talk about it in terms of nursing, but as a whole.
Yeah.
So getting to Ukraine, there was the shock of, yeah, even before starting this war that's going on, even before that happened, something I learned about their lifestyles. They're not very rich people, at least not by our standards.
Mm.
Yeah, so
Okay.
but um there's a level of accessibility for the general public that presents, which I like, right?
Mm.
So
Okay.
most people across all boards have access to certain things, and it's not going to like
To
bankruptcy. Like a lot of people know this thing in Nigeria. They're like you're literally a medical emergency away from bankruptcy in Nigeria
yeah.
because
Yeah.
healthcare is so
Mm-hmm.
expensive here. So
Mm-hmm.
at least like so they have like emergency services. I do
Mm.
like how they structure their hospitals because
Okay.
at least okay, I schooled in Zaporizhia, that's the city I lived in,
Mm-hmm.
and there were multiple huge hospitals. Like there were almost every hospital was this. There was a general hospital, fine. There were like a few general
Yeah.
hospitals. There were specialist hospitals. So
Mm-hmm.
when you had a problem, they kind of knew exactly where they were taking you. Like let's say it was an emergency or something.
Mm.
Call the
Yeah.
ambulance, and then
Yeah.
they were taking them to this particular place, which I really like
Mm-hmm.
because
Mm-hmm.
if you're in the specialist hospital, basically there are lots of people
Mm-hmm.
who can deal with your problem. So
Yeah.
I really like that aspect. Now for the schooling
Mm-hmm.
aspect, so I studied in English language. The city I lived
Mm.
in, they mostly spoke Russian at the time, but by the time I was graduating, most people had shifted to Ukraine. So I was taught
Mm.
Russian because it was
Oh,
compulsory
okay.
was part of our
Yeah.
curriculum, then part of the language up to like third year or so, because you also had to learn
Mm.
medical terms in Russian. So,
True.
but,
Mm-hmm.
but most of my classes were in English. My lectures were in English
Mm-hmm.
because I was on the international faculty. Um, so at the end of the day, first year to third year is preclinical. That's like the same thing that we do here in Nigeria. Then fourth to
Mm-hmm.
sixth year, clinicals. So basically, you're doing all your lot of your theory and stuff. You're doing basically just theory first third year. Then fourth to sixth year, you're going to hospital regularly. You're
Mm-hmm.
seeing patients. You're attending clinics. You may attend some surgeries, like as a medical student, you're still a student.
Mm-hmm.
So it's not like you're necessarily doing anything, but you're there, you're observing. That's part of your learning process. So okay, I would say that for sure there was a language barrier to some extent because
Yeah. Yeah,
yeah, I mean we
obviously.
learned Russian, but we're not fluent. Some people grew
Oh,
fluent.
okay.
There are people that
Mm-hmm.
dated the natives
Yeah, yeah.
grew fluent very quickly.
Mm-hmm.
But some of us we it took a while. I was never fluent, though I could get around. So there'd be some things
Yeah.
that would hamper how much you actually understood. And
True.
again, my personal experience, my school, there you couldn't really like, so I think the main thing I would say is that language thing because there were
Mm-hmm.
quite a number of patients that were okay because being
Mm-hmm.
present, like, for their examinations or
Mm-hmm.
with them like during the clinic. Some patients were actually okay with it. Some
Mm-hmm.
people were not.
No.
And I'm not going to
Mm-hmm.
jump and say it's a race thing because worldwide, even here, like sometimes patients are not comfortable with students being present. And everybody
Yeah.
wants to decline, honestly. It's,
Mm-hmm.
it's how we learn.
Mm. Huh. Um, yeah, that honestly, that's interesting because even when you even go to when you go to an English speaking country, there's still always maybe not necessarily language barrier, but there's this social cultural learning process that you need to go through to
Yeah.
understand how things are done,
Good.
especially for coming from Nigeria. um, but yeah, that is interesting. I wanted to go back to when you said the way their hospitals are structured. Um, that's particularly important because whether I like it or not, it affects the way people see hospitals
Mm.
in um in Nigeria. Um, and I was just maybe not go too deep because this is an intro episode, but what's not necessarily the difference? Um, from where you stand, what are the things that could be done better, especially for Nigeria healthcare in
Okay.
general? The way Nigerian hospitals are, I guess, built, shaped in terms of not just physically, but policy wise. Um, what could be better?
Okay. So, like with a lot of things, um,
Mm-hmm.
not just a lot, like with a lot of things, it really helps when the government is
Yeah.
invested in
Yeah.
developing the sector. So
Mm-hmm.
something I didn't mention, I mean, something I forgot to mention about
Yeah.
Ukraine was that a, l- a lot of their things, um, let's say government regulated slash government funded.
Mm-hmm.
So housing, schooling, like
Yeah.
there, like so many things are
Yeah.
regulated and funded by the government. Even the whole hospital system I told you about. To be fair, this that I think that's actually partially like a leftover thing from when when they were talking to the Soviet Union. The
Yeah.
whole hospital and the numbering system, the
Mm-hmm.
hospital numbering systems. I think it's a leftover thing from
Yeah.
when they were part of the Soviet Union. But the government still like upheld that, and how do I put this? It's controlled by the government. So there are still private
Yeah.
hospitals. You had the
Mm-hmm.
choice to go to private hospitals if
Mm-hmm.
you want. No one will stop you. Of course, you just simply have to pay out, which is fine,
Mm-hmm.
right? But what
Mm-hmm.
okay I admire about that about about the system is that like everybody gets a chance at least for some
Yeah.
basic stuff. Everybody gets a chance.
Mm-hmm.
It's not that, oh,
Mm-hmm.
okay, somebody somebody who is struggling and living paycheck to paycheck, and then a medical emergency happens, and then
Mm-hmm.
they literally have nothing left. You have to start crowdsourcing
Yeah.
for something which would have been beautiful if it could have just been covered by like insurance or something.
Mm-hmm.
Same thing with,
Mm-hmm.
like the NHS, right? In the NHS
Mm-hmm.
in the UK now, you don't you don't have to. You can literally be a homeless person and access
True.
medical.
Mm-hmm. Mm-hmm.
And because health is so precious. My God, health is so precious.
Yeah.
It's really
Yeah.
sad. difficult to get people up in need sometimes. That's actually risky.
Mm-hmm.
And the only way I see that
Mm-hmm.
happening is the government providing electricity for these sectors.
Yeah.
Because at the end of the day, you
Mm.
can't expect it to be done on a volunteer basis. People
Yeah.
have to eat. And there's so many
Mm-hmm.
different components, so many things that make up the health sector. I feel like a lot of people
Mm-hmm.
just see doctors and nurses and pharmacists, and then that's it. Okay, lab science. I feel
Mm-hmm.
like they see these four professions, and it's like, okay, that's it. But there's so many
Mm-hmm.
other um people working behind the scenes that make healthcare what it is. There's a lot of administrative duties. There's a lot of sourcing, budgeting. There's so many things involved
Mm-hmm.
that it requires adequate funding. And for it to be
Yeah.
accessible, the sector has to be like it has to properly be invested in by the government of whatever
Yeah.
country it is.
Mm-hmm.
Until that is done, I think okay, for me, it would be beautiful if healthcare could be
Mm-hmm.
accessible to everyone because of
Yeah.
how
Yeah.
precious health is. But
Yeah.
because we are in a country where well, not just it's not just our country, but I guess I can only speak
Yeah.
for Nigeria because of the
Mm-hmm.
way things are for us currently.
Yeah. Mm-hmm.
Most people are going to prefer private healthcare because of the resources and things that are
Yeah.
made available there, right?
Mm-hmm.
But thing is private healthcare is going to continue to be expensive because at the end of the day, you need money to run this place.
Yeah.
So kind of
Yeah.
just a sad just like at the end of the day, healthcare takes a lot of money to run, and for it to become very accessible to the general public, it needs to be
Mm-hmm.
taken care of by a huge body. And I
Yeah.
guess
True.
that's government. Yeah, it needs to probably be
That's the
invested.
government. Yeah. And I totally agree. And I guess again, that's why we're having this conversation. Anything that is going to move forward in a country, whether I like it or not, needs to be initiated, needs to be regulated, needs to be pushed by the government. Like you said, because from the government standpoint, it's not going to be necessarily profit profit driven. It's going to be for the people. We're
Yeah,
doing it for the people.
it's for the people.
But for private companies, it's going to be um it has to be profit driven
Yeah,
because they need to continue running the business. Even if at the point where they are saying, oh, we're doing it for charity, at some point they need to make money back to continue to
to
run the business, even
continue.
if they are not going to get, yeah. Um, so yeah, like any huge endeavor needs to be funded by the government. At least needs to be started by the government. So yeah, so I totally agree. um, I want to shift from that quickly to the people. Um, and I guess what's the public conversation about health in Nigeria? What's the general idea? And it doesn't have to be one thing, and it could be one thing, probably not. But what's the one general public conversation when people talk about health in Nigeria? And this is from you, what you hear. It's
Mhm.
probably from patients. Um, I know a popular one is they don't like going to the hospital. There's this popular belief about going into the hospital and not coming back. um, and if it gets to the point where you need to go to the go to the hospital, um, it almost means the case is terminal.
Yeah.
Um, but yeah, from what you've seen, what's the general public conversation?
Okay. So similar to what you said,
Mm-hmm.
there's some people that do believe. It's very ironic,
Mm,
because what you said about people believing that, if you have to go to the hospital, terminal, is especially true for when people go to tertiary
yeah.
institutions. So okay, I think I have to just do a little bit of explanation here. So we have
Okay.
primary, secondary, and tertiary institutions. So
Mm-hmm.
primary institutions are places like public health centers. So they are not necessarily um they don't they're not a complete complete proper hospital, if that makes sense. There's usually a doctor
Mm-hmm.
on ground, nurse on ground. It's more or less just a clinic, not really any
Mm-hmm.
admitting facilities or anything. But these are institutions that can deal with the regular day-to-day small complaints that patients have. Um, you usually find these in like rural areas. Actually.
Yeah.
So and these
I
actually
think.
address a lot of their little problems, right? Meet the needs for that.
Mm-hmm.
Then you have secondary institutions, which are quite frankly, I think a lot of private like
Mm-hmm.
um a lot of them. So like you can have some admitting facilities, but they're still limited, right? Go to
Mm-hmm.
ICUs. So now you have tertiary institutions like teaching hospitals, um, and a
Mm-hmm.
lot of care to because of the thing that you said. But they're like, I'm going
Yeah.
to so and so teaching hospital. Like we know of this person that went to, they didn't come back. Like, no.
Mm-hmm.
And so the sad thing is, usually if you actually dig deep into the cases of people who died in teaching hospitals, you will find that their health journey is right.
Mm.
They usually the health that thing usually whatever the progression of their illness has
Yeah.
probably been for a period of time, and they
Mm.
usually have
Yeah.
started somewhere else, right?
Mm-hmm.
Somewhere
Mm-hmm.
more affordable to them or somewhere that is of easier access to them. They've usually started
Mm-hmm.
trying to seek help somewhere else, and in past things have not
Yeah.
gone too well. They've been referred and referred and referred, and then they
Mm-hmm.
ended up at the teaching hospital
Mm-hmm.
towards the tail end of the journey,
Mm-hmm.
and they finally passed away there. There are
Mm.
times when, getting to the teaching hospital, because at the end of the day, teaching hospital is where you see a multitude of specialists. So you actually,
Mm-hmm.
it's ironically, it's your best bet because if they need to refer you to someone else, they're likely
Mm.
going to be within the same facility. And so they come and see
Mm-hmm.
you or you go to the clinic.
Yeah.
Um, it's just that a lot of the time we tend to, as humans, and I think especially as people in the workforce, young,
Mm-hmm.
young, young and older people in the workforce, we may get certain symptoms, and we don't really
Mm-hmm.
take them so seriously. We try and manage, and we're like, oh, okay, it's not that serious. I'll be fine. I'll take a painkiller here and there. Okay, I'll sleep more when I
Mm-hmm.
get the plans and all that. And this time, you're not getting better. That's when you now start to panic. You complain to
Mm-hmm.
somebody and the person says, oh, this my friend had this same complaint. We used it, so you should try it. So it's things like this can cause delays in finding out what's actually wrong. And then by the
Yeah.
time you get to know what is wrong and you are referred to the place where, you may be able to get help, which is a tertiary institution. It's not only teaching hospitals that are tertiary institutions. There are actually some private facilities that have, that much they have that much infrastructure and staff that they're also considered tertiary institutions. But so
Mm-hmm.
usually by the time you are referred to a tertiary institution, it's like it may already be too late. The disease
Mm.
progression may have already gone too far because there's a limit to what you can do. Early detection of any disease is
Yeah.
crucial in, resolving it,
Mm-hmm.
reversing whatever whatever effect it has had in the body. Because
Mm-hmm.
I'm sure there are people who hear, oh, somebody died and they died of malaria. And for us,
Mm.
Nigerians, like, malaria. Is this simple malaria that killed somebody? What do you mean? Is it that they cannot treat the malaria? But what most
Yeah.
people don't know is that there's a level of, because at the end of the day, malaria is a parasite that, is in the bloodstream and it's
Mm-hmm.
transmitted via mosquito bite. And what a lot of people don't know is that there's an amount of, and these parasites, they keep multiplying. They literally will keep
Mm.
multiplying because like that's what parasites do. And they
Yeah.
get to an extent where it's basically like an overload on the body.
Mm-hmm.
Like
Yeah.
they and thing is they target like red blood cells. So by the time they've gotten to a certain amount in the body and because they end up destroying red blood cells. If you have enough red blood cells destroyed, you become anemic. That's, your blood is low, right? And that
Mm-hmm.
leads to its own complications. And, there's so many complications that can come out of simple malaria. And
Hmm.
why these complications come about? Because treatment wasn't started. Standard
Yeah.
treatment for malaria is our usual metal lumefantrine tablets. That's like, your
Yeah.
Lona, your
Mm-hmm.
Coartem, right? And if you
Yeah.
detect malaria in time, you can literally take it from your house. Right? You don't even have to miss work. Like you do everything and you're fine. But somebody who has been
Mm-hmm.
having symptoms, doesn't get checked, doesn't really take care of themselves, it can get so bad that they have, cerebral malaria. And that's literally somebody who has malaria and they're having neurological symptoms as well, all from
Mm-hmm.
simple malaria.
Hmm.
So I think I think it's multifactorial, but
Mm.
sadly, some people definitely do not have health seeking behaviors. What I mean
Yeah.
to say,
Yeah.
we try to, I'm guilty myself, I'm not even going to lie to you, somebody who works in the healthcare sector. We try to minimize our
Mm-hmm.
symptoms. Okay, we're fine. I'll be fine. And then sometimes that could sometimes lead to
Mm-hmm.
dire consequences.
Mm-hmm. Yeah. Um, I like how you systematically broke it down from and used early detection all the way from primary to tertiary. And one thing we kind of talked about it is um access, which now goes back to money. Most people try to minimize it or try to push back because even I guess even the teaching hospitals or the government-owned hospitals, they are not necessarily cheap for some people because of
And
the
that,
economic factors in Nigeria. So, but yeah, that's interesting. Um, I want to, um, I want to, before we pivot back to you, generally, I guess, what's the wildest thing you've heard in the consulting room? Say,
ah,
I mean, what are some of the wildest things you've heard that people have said and you had to maybe correct on the spot? And honestly, you don't need to shy away from because I know Nigeria is very cultural.
yeah.
Um, I've had
Okay.
friends who, okay, continue.
Okay.
Yeah.
So the thing is, the thing about working in healthcare is that I swear you see people in various. I feel like you see people at their worst.
Mm-hmm.
Um, not just sick people, like not in the sense of they depravate their body and you're seeing them in such a bad state physically. You also see,
Yeah.
and I'm not trying to put blame or say that people should try and be at their best because it's difficult.
Mm-hmm.
Being unhealthy is difficult,
Yeah.
and it's difficult not just on the person that's unhealthy, but on the people that care about that person. It's really
Yeah.
difficult, and there's usually a lot of pressure at the time. And I'm I'm speaking as a healthcare worker and as somebody who has
Mm-hmm.
had a sick relative, right? So
Mm-hmm.
it's
Mm.
difficult.
Yeah.
Being unhealthy is very difficult on everybody involved.
Mm-hmm.
So so sometimes there are people who have actually said things and have come back later to apologize. So they're like, "Oh, I'm sorry,"
Mm.
and I
Yeah.
think this is just a part of being human.
Yeah.
Though the thing is, the people on the receiving end of it, sometimes we have to develop a means to just, brush some things off because
Yeah. Yeah.
it can be bad for your mental health sometimes. But
Mm-hmm.
one, so there's always this mindset that, let me not say always, but I think it's a common mindset where people like, oh, okay, we're recommending certain things because we're trying to get money, right?
Mm.
Okay, so like
Yeah.
now there's
Yeah.
there's something there's something very common with our people. A lot of, and honestly, it's understandable. A lot of women want to
Mm-hmm.
give birth vaginally, right? A normal
Mm-hmm.
delivery,
Mm-hmm.
and that is understandable. And frankly speaking, it that's the way we were designed. So
True.
that's what we want, right?
Mm-hmm.
Everybody, a lot of women want to give birth vaginally. A lot of people don't want CS.
Mm-hmm.
So, but there are some cases where CS is necessary if
Yeah.
we want to ensure that both mother and child are fine.
Mm-hmm.
And
Yeah.
for us, at least that's something I kept being taught, is that a successful delivery is one in which both mother and are fine. It doesn't
Mm.
matter how it happened. We want the two
Mm-hmm.
of them to be well and okay, right?
Mm.
So that I'm not gonna say that's the wildest thing I've heard, but I feel like I have to sit down and think because I've heard a
Yeah.
lot.
Yeah.
I've heard a lot
Oh
of
no.
it. But yeah,
Yeah.
so but that's
I,
the common thing. It's like, oh, it's a cash
mm-hmm.
grab. Nothing is actually wrong with my wife.
Mm.
They just
Yeah.
want. Sometimes it's a necessity. It really is a necessity.
Yeah.
Like baby could
Yeah.
die, both could die, both could die, and that's really tragic. Honestly.
Mm-hmm. Yeah. And I think that will happen. Um, most people will have that thought when they're anything that has money exchange, whoever is dropping or paying for a service usually has it at the back of their mind that they're being ripped off,
Yeah.
especially when they feel they are not getting enough value for what's in exchange for what they are doing. Interesting. And yeah, I think it's cool that some people come back to apologize and stuff.
Oh,
But
exactly. Some
um
people too, they're like, oh,
yeah.
and it's like it's fine. We understand because at the end of the day,
Yeah.
we're healthcare workers, but we're people too. We're not always
It's
healthy.
true.
So
Mm-hmm.
we experience the same things as well sometimes.
Mm-hmm.
So it's like you can understand sometimes. Sometimes.
Yeah.
So, yeah, we're not
Yeah.
always out to them a lot of the time. Okay, like now, you also like where I work, I have no
Mm-hmm.
access. I don't know how much tests are. I mean, I have access to check,
Mm,
but you get
yeah.
that's killing the
Mm-hmm.
part. That's not me. I'm solely focused on the patient in front of me.
On the plane. Yeah.
Yeah, and so that's usually how it is for a lot
Mm,
of you. Those things are not actually our business. It's the patient's health that we are trying to chase.
mm-hmm. Yeah. Nice. Would you do this? Would you do this again?
Like medicine.
Yeah.
Hmm. Well, if I could go back, um, I probably still would.
Mm,
But
probably.
so this is a personal. Again, this is a personal
Yeah.
thing. So okay, I wanted to be a doctor since ever. So this really
Mm-hmm.
was just a competition of, for me, becoming a doctor was just a competition of a process that had started since. So like, yeah, no, I'm going to be a doctor. No, I'm
Yeah.
not giving myself any other
Mm-hmm.
choice. I'm going to be a doctor.
Yeah.
And there was
Yeah.
also, I also felt maybe I'd like to write on the side. And I mean,
Mm,
there are a lot of people in medicine that have written, where they write
yeah.
essays, books, and stuff, right? So that's
Mm-hmm.
something that was the ideal for me growing up. I still
Mm-hmm.
remember I saw one of they made us journals when I was just three or something, and I remember seeing what I wrote, and I
Yeah.
was like, I was like, I'm going to be a
Pretty
doctor.
good.
Yeah, I was like, I'm going to be a
Okay.
neurosurgeon. I have no interest in neurosurgery now. Like, I'm going to
You
be,
don't.
you know,
Yeah.
I'm going to be a neurosurgeon. I'm going to write books as well. I had plans to be awesome. Oh,
Yeah.
well, I love little me. I love how enthusiastic she was.
Mm,
I mean, I think I would probably still would do nursing, but with little, I'd tweak a few things along the way. Maybe I wouldn't take the direct path.
Mm, yeah.
Especially because I can't really see myself doing anything. It's like
Mm,
the good thing we say sometimes, like nothing is like a jealous love, like takes everything from you. So it becomes
yeah.
difficult to see yourself doing anything else.
Mm-hmm.
So it's really important to strike a balance. Um,
Mm-hmm.
which is what I'm trying to do now, trying to make
Yeah.
sure I keep my other interests alive.
Mm,
And so
okay.
I probably would say,
Yeah.
probably would.
This- yeah. I guess. I mean, but first and foremost, I think yeah, I think you're awesome because anybody
Thank
who's
you.
saving lives,
Yeah,
anybody who is in the business of saving lives, trying to convince, especially in Nigeria, with so many factors that seem to go against, I guess, the profession, or your profession, healthcare profession, and then coupled with the cultural nuances of the people that you're trying to help in terms in healthcare. Yeah, it's pretty awesome. But going down that lane of striking balance, just for people to get to know you more, I guess. What do you do in your downtime? I mean, I don't know how much downtime you have, but what are some of the things that you
definitely.
and
So
yeah
I've always
dabble
liked,
into?
so I've always liked the arts on some
Okay.
level. So like
Mm-hmm.
um, books, literature,
Mm-hmm.
movies, comic books,
Yeah.
anime,
Oh,
manga.
really?
So I'm like I've always it's funny, I've liked stuff like that since like, secondary school since I was little.
Mm-hmm.
So that hasn't really gone away.
Yeah.
Of course there was actually a period in time where I kind of just lost the plot and um I wasn't really indulging in things found that I found interesting. But over the
Mm-hmm.
past few years I've tried to go back to those things that I used to enjoy. And so far it's
Mm.
been good. So try to I also like food a lot. I like delicious
You
food.
say food?
Yes,
Oh,
I like
yeah. Yeah.
food.
Mm-hmm.
I don't like making it, but I like cooking it. So so
Nah.
I try my
Yeah.
best to find, um to find new things that will
Mm-hmm.
stimulate my palate. So
Yeah.
try not to shy away from trying out new foods and stuff.
Mm-hmm.
I read novels. I read quite a number of novels. I have
Okay.
yeah, I have novels on my
Mm-hmm.
phone. I have physical copies of the books.
Mm-hmm.
I watch movies too. Um,
Mm-hmm.
I try to journal to de-stress. When I'm actually really
Yeah.
stressed, like when I'm emotionally, funny enough, I don't journal as much, but when I'm under a lot of like pressure,
Yeah.
that's when I tend to
Mm-hmm.
journal. Just try to help it clear my mind. So I do journal. Yeah, and I spend time with people that I like. So
True.
there's that
Mm-hmm.
too. So just trying
Mm-hmm.
to go to the cinema. Um, but yeah, these things come in waves. So like there was a period of time
Yeah.
I was like painting, like I go for all these sip
Mm-hmm.
and paint things. Yeah, so I have have a few of those. Like I have like pottery sets, like pottery paintings, stuff like that.
Oh,
So, yeah, so these things they
nice.
yeah, and we do these things as group activities. I literally went out with two of my friends who are also doctors yesterday and went on.
Oh, nice.
So we just went on art gallery to eat after. So just stuff like that. It helps. We
Mm-hmm.
spend time outside work. Um,
Mm-hmm.
yeah, and I try to keep work at work. I try
Mm.
to sometimes I
Okay.
joke like
Yeah.
okay, I have
Mm-hmm.
friends that are not in the medical field and I didn't meet them in the hospital. But then sometimes some of them will literally be like, ah, Dr. Nana, and I'm like, you did not meet me inside hospital. I don't understand why you're calling me this. Like, call me by
Yeah.
my name,
Yeah.
please keep what there's nothing hospital right now. Please, can we
Mm.
just
Yeah.
yeah, address each other as per normal? So
Mm-hmm.
yeah, that's what I just try to do. Just like any other person, honestly. I think this is what
Yeah.
most people do outside. So
Mm-hmm.
I think work-life balance is it's important, but I think it's so important because at some point, if you don't have that, it breeds resentment at some point, and then you're like, what am I even doing here? You don't, and then you get burnt out really quickly. And I think I have
Mm-hmm.
experienced burnout, and it's not nice. It's not nice for you. It's not nice for people you're attending to. It's not nice for your colleagues.
True.
So
Yeah.
it's good to have a balance.
Mm, yeah.
But
Um.
right now, I'm into anime.
Okay. Nice. Um. I guess two questions. First, what anime are you watching?
Jujutsu Kaisen. Sorry,
Um.
I'm like a fangirl, like a proper
Okay.
fangirl. Yeah.
Um. Last question.
Sorry.
Favorite. I said last question. Favorite superhero.
Hey. Whew. Okay, my favorite superhero.
Yeah.
To be honest, this isn't really even a question. So
Okay.
from Google, Sunny. Like I don't think I've liked any other superhero except Spider-Man.
Oh, did you say Spider-Man?
Spider-Man, yeah. Like I mean, now there's all
Ah.
these, yeah. So I don't know if I'll sound political first, but like Marvel has its issues and stuff like that. But like literally from the days of Tobey
Yeah.
Maguire, I've always been Spider-Man.
Okay. Yeah.
Yeah, there was never
Ah.
anybody else. So
Hmm.
yeah,
Okay. Nice. You see the new Spider-Man
I have.
movie. Oh, okay. Um, yeah, that was my last question. Um, yeah, expect Dr. Nana to come on as often as possible. We'll talk about health sector. We'll talk about why people should take your health seriously. We will not prescribe any drugs, medicine. We will not diagnose you. We are just going to have a conversation around health sector. Um, Thank you, Dr. Nana, for coming through. Thank you for speaking to me on this intro episode. Want to say, I guess, maybe about the episode, what people should expect before we bounce.
Well, I think this is new for me, so I think
Okay.
I'd love
Yeah.
to just be as helpful as possible as I can be. So I'd love to share useful
Mm-hmm.
information as much as I can. And I feel like I'm going to probably give a lot of personal anecdotes whenever I talk about things because,
Yeah.
these may be
Mm-hmm.
things that I've experienced or that I've seen happen. So
Mm-hmm.
I look forward to the coming episode. I really do.
Yeah.
And I really hope, they they do what we hope that they do. Hope they help people and
Yeah.
they get people to talk more
Mm-hmm.
seriously.
Yeah. Same. Um, yeah, same. I hope so too. And um, yeah, people, listen, take your health seriously. Thank you, Dr. Nana. We'll see you next episode.
Thank you for having me.
Yeah, you're welcome. Bye.